Let me introduce you to a girl who changed my life. A young girl, she was 14 when we first met, and as you can see, she had severe bow legs. The surgery to fix her legs wasn't too complicated. We divided her bones, realigned them, put her in plaster, and then here she is out of plaster. As an orthopedic surgeon, I had an orthopedic surgeon's look at her legs, and I thought, not a bad result. A friend of mine, however, looked at the pictures and said, this little girl's life has been changed. Don't just look at her legs, look at her new dress. Look at the fact she's now wearing earrings. This teenage girl can now do what teenage girls do. Now, this girl's life may have been changed, but she changed my life in two ways. Firstly, because she took my mind away from being a normal orthopedic surgeon, looking at legs in terms of angles and where we needed to cut, to looking at the impact of physical impairments on the life of a child, the life of the child's family, and the life of the child's community. And that changed the way I worked, that changed the way I operated, it changed the way I taught, and it changed our research. The second way she changed my life was because her story touched the hearts of ministries of health and of donors across the world and enabled us to build an orthopedic hospital in Malawi specifically for children like her, a hospital where they could receive treatment for their physical impairments, but also where they could be respected, nurtured, loved, and as their limb was reconstructed, so could their self-esteem be reconstructed. And we were able to build a second one in Zambia, and we're just about to finish one in Zimbabwe. So she changed my life. People often ask me why I've spent so many years in Africa working with children with orthopedic conditions. I've got three answers to that. The first one, as a Christian, I want to show God's love to a group that's most needy. The second reason is because it's an inescapable fact that in the West, and in the NHS particularly, our healthcare is better than most of the world, and I believe we have the duty to share that. And thirdly, because of the incredible rewards of being involved in this work. I could spend all evening telling you the rewards of helping children to walk again, the scientific rewards of working out better ways of treating them, the organizational rewards of improving services, and the rewards of deep friendships that come with colleagues in low and middle income countries through many years of working together. One of my passions is Clubfoot treatment. And if this works, you may see a picture of a Clubfoot, but I'll just carry on talking as if it were to work. One of my passions is Clubfoot treatment, and I was going to show you a picture of a Clubfoot, but you can just imagine it. And then, following that, there was going to be another picture of a Clubfoot, of a child with severe deformities in his Clubfoot. Now, every year in Africa, 30,000 children are born with club feet, and the majority of these don't get all the treatment that they need. The title of a recent paper that we've just published, looking at the impact of Clubfoot on the lives of children, has 4 words in the title, and 4 words that say it all: indignity, exclusion, pain, and hunger. Indignity, because these children are so often valued as of less worth than children without physical impairments. Exclusion, because they can get excluded by their family, by their communities, even by their friends, and often by the school, so they're less likely to get to school. Pain, because of the putting weight on the deformed legs that sadly you can't see. And hunger. Why hunger? Well, hunger because so often food is associated with social occasions, and if you're not invited and you don't get there, then you stay hungry. But Clubfoot is easily treated if it's caught early. But sadly, the majority of the 30,000 cases in Africa don't get caught early. There were going to be more pictures of other children, but you're just going to have to imagine them, of cases that have been treated. Our National Health Service trust in Oxford is working together with experts in 18 African countries to design a training program for treatment in Clubfoot. The reason that the majority of the 30,000 don't get treated is because in many countries there are limited services and also there are limited trained personnel. The training course that we've developed over the last 2 years, we have devised it, we piloted it, we tested it, we retested it, and we did that 4 times in 5 different countries. We've now started to roll out across Africa. And I was going to show you pictures of children who've been... And they're on again. Okay. Thank you so much, the guys in the back who I can't see. This boy was in so much pain putting his weight through his feet that he preferred to walk on his knees. And there he is, after his treatment, doing what we boys like to do, just wearing jeans and standing around in town. And these 6-year-old kids, all of them has had a treated clubfoot, but you wouldn't know because they're just doing what 6-year-old children do, running around after a football, and that's the boys as well as the girls. One of the pleasant surprises about being involved in global healthcare is when things come back and bring benefit to the National Health Service. And it was very exciting for us when the UK Clubfoot Consensus Group, the group that organises clubfoot treatment and quality standards in the UK, heard about and saw our Africa Clubfoot training course and said, can we have that for the NHS? Can we use that course to train healthcare professionals in the NHS? Now, that wasn't our aim when we designed the course, but it's an amazing secondary benefit and an incredible accolade to my many colleagues in African countries who've been involved in setting up that course. One of my roles... Oops. We'll leave that picture on there. One of my roles now is encouraging UK surgeons to think about global surgery and to get involved in global surgery. Many surgeons take an interest and they come to me and they say, Chris, I've got 2 weeks off. I could go over to Africa and do a pile of operations. And I say to them, thanks for the thought, but actually it doesn't work like that. It's not all about you. It's not all about the operations that you can do. By all means, take the time, go, meet your colleagues, talk to them, but find out what's happening there. Develop relationships. It's relationships that count. It's relationships that take time. It's not all about you, and it's not all about the surgery that you can do. Well, our world's getting smaller. It's easier and easier to communicate. I strongly believe that each of us has a duty to reduce the gaps in global health need. I've talked about surgery and orthopedic surgery because that's what I do. I don't know what the rest of you do. In fact, I can't even see you. But I do know that many of you, as students or as trainees, are about to embark on the exciting journey of a career in the NHS. To all of you, I say tonight, think global, or keep thinking global. If you get the opportunity to visit colleagues in resource-poor settings, take that opportunity. Meet those colleagues, sit with them, talk with them, but go without preconceptions. Listen to them, listen to their dreams, talk with them as to how you might best collaborate. I don't know what great things you will do together. Thank you.